Painful cycle fluctuations. Overview. There are many causes of shoulder pain and not all of them are due to problems of the shoulder joints or associated structures. Arthritis. Osteoarthritis, rheumatoid arthritis, post-traumatic arthritis, rotator cuff tear arthropathy, avascular necrosis. Injuries and sprain. Number 1. Ligaments. Ligaments are soft tissues that connect bones to bone. They provide stability to your shoulder by keeping the bones where they are meant to be. If the ligaments are injured or sprained, they can cause short-term pain. This may be a result of the humerus coming partially out of the joint socket, that is subluxation, or if the humerus comes completely out, that is dislocation. Number 2. Labral tear. The flexible tissue that helps keep your shoulder joint in place, that is the labrum, can become torn. This is called a labral tear. This can occur as a result of an injury, for example falling into your outstretched arm or repeated actions, for example throwing sports such as cricket. Number 3. A direct blow to your shoulder can result in the acromioclavicular joint being sprained. This type of injury often occurs in people participating in contact sports such as football who take a blow to the shoulder. It can also occur as a result of a fall. Number 4. Rotator cuff. This group of tendons and muscles keep your shoulder stable and positioned correctly for your shoulder and arm to move. Tears to rotator cuff tendons may occur as a result of an injury, that is a fall, broken collarbone, or happen over a period of time as you age. Inflammation of the shoulder capsule. Synovitis is when synovial membrane becomes inflamed. It can occur as a result of another condition, that is rheumatoid arthritis, or it may happen as a result of an injury, or the cause may be unknown. Frozen shoulder, that is adhesive capsulitis, is a condition that occurs when your shoulder capsule thickens and becomes inflamed and tight. There may also be less synovial fluid to lubricate the joint. As a result, your shoulder becomes difficult to move. Frozen shoulder may occur as a result of another condition, that is diabetes, if the shoulder has been immobilized. Inflamed bursa. The bursa that sits between the rotator cuff tendon and the bony tip of the shoulder, that is acromion, can become inflamed, most commonly with repetitive movements. Neck and upper back. Problems with the joints and associative nerves of your neck and upper back can also be a source of shoulder pain. The pain from your neck and upper back is often felt at the back of the shoulder joint and or through to the side of your upper arm. Injury to the axillary nerve. This nerve can be injured if you dislocate your shoulder or break your humerus. This can cause weakness when moving your arm outwardly away from the body. Referred pain. Shoulder pain may also be caused by problems affecting your abdomen, that is gallstones, heart, that is angina, heart attack, and lungs, that is pneumonia. Shoulder joint osteoarthritis. The first symptom of shoulder arthritis is pain in the affected area. The pain gets worse over the time, affecting your range of motion. Shoulder osteoarthritis is not as common as osteoarthritis of the hip or knee, but it is estimated that nearly 1 in 3 people over the age of 60 have shoulder osteoarthritis to some degree. In osteoarthritis, the cartilage in the shoulder joint gradually wears down and protective space between the bones decreases. Bone-on-bone rubbing and friction in the joint leads to pain, stiffness, and limited range of motion. Everyday tasks like combing your hair or carrying a bag becomes more challenging and painful. Loss of range of motion in the shoulder can also lead to muscle spasms throughout the shoulder and the neck, which can cause headache. Osteoarthritis usually affects people over 50 years of age and is most common in the acromioclavicular joint than in glenohumeral shoulder joint. Case study. A 65-year-old female patient came to the hospital with a complaint of right shoulder pain. There is no history of fall. The pain is worse after activity and morning stiffness persists for 20 minutes. Sign and symptoms. Pain due to rubbing of bones in the shoulder joint. Progressive increase in the pain. Discomfort and difficulty in movement. Inability to sleep due to persistence of pain, especially at night. Loss of the motion in the shoulder joint. Blockage in the movement of shoulder joint owing to the presence of osteophytes. Weakness in the rotator cuff. presence of shoulder muscle atrophy, inflammation and tenderness in the shoulder can be a symptom of glenohumeral arthritis. Motion in the shoulder joint produces clicking sound can be a symptom of glenohumeral arthritis. Differential diagnosis: gout, rheumatoid arthritis, CPPD, that is calcium pyrophosphate crystal deposition disease, septic arthritis, osteoarthritis, polymyalgia rheumatica. Diagnostic investigations: X-rays. X-rays show bony spurs, subchondral cysts, subchondral sclerosis, joint space narrowing. MRI. MRI shows articular cartilage wear down. Blood tests: rheumatoid factor negative, ESR, that is erythroblastic sedimentation rate, and C-reactive protein normal. Assessment: measure the range of motion, palpation for tenderness and swelling, move the joint to hear for cracking sound called crepitus. Special tests: diagnosis: glenohumeral osteoarthritis. Plan of care: when designing a rehabilitation program for patients with painful shoulder, it's important that the following key factors should be considered. Onset of pathology, degree of instability and effect of their function, frequency of dislocation, that is chronic versus acute, direction of instability, that is posterior, anterior or multidirectional, and range, neuromuscular control, activity level. This rehabilitation program will be divided into two categories: traumatic and atraumatic. Non-surgical treatment: non-steroidal anti-inflammatory drugs, medications. These medications like ibuprofen and naproxen are given to control the inflammation. Corticosteroid shots. The corticosteroid injections are given when NSAIDs fail to provide the required relief. These are anti-inflammatory injections that help to relieve pain temporarily but do not help to treat the conditions. Viscosupplementations. This treatment include injecting hyaluronic acid into the joint to improve cushioning and lubrications between the joints and also reduce the joint frictions during the movement. Non-prescription supplement. These are glucosamine supplements that reduce the activity of enzymes contributing to osteoarthritis and also help in the formation of new cartilage. Modalities. Physiotherapist aims to improve the mobility in patients in such cases. Techniques used by physiotherapists include manual therapy, stretching and strengthening exercises, weight management training. Physiotherapists usually perform a physical assessment test before starting the treatment. The assessment majorly involves evaluation of the gait, daily life activities, range of motion, muscle strength test, posture and respiratory function. Afterwards, they use the Arthritis Impact Measurement Scale 1 and 2 and the Health Assessment Questionnaire for a precise assessment. Modalities. Hot and cold applications. Hot or cold therapy is used in both acute and chronic conditions of osteoarthritis. Cold packs are usually applied in patients suffering from acute conditions, and hot therapy is applied at chronic stage of OA. Hot packs are usually applied for 10 to 20 minutes once or twice daily. For cold therapy, application modalities are cold packs, for example ice, nitrogen spray and cryotherapy. Electrical stimulation, that is transcutaneous electrical nerve stimulation aka TENS therapy, is the most common form of electrotherapy used to treat osteoarthritis. Studies have reported that patients experience less pain after receiving TENS therapy once a week for approximately a month. Hydrotherapy. Patients get relief from OA if hydrotherapy is performed at regular intervals. This technique provides palliative treatment in case of acute and chronic conditions. Massage helps relieve pain and eases the muscle stiffness associated with arthritis by improving circulation, helping to reduce inflammation. That translates to enhanced blood flow to arthritic joints, improved movement, and reduced pain. Physical therapy can help to reduce the pain, swelling, and stiffness. Exercise protocol. Shoulder exercise pendulum, crossover arm stretch, wall crawl, wall push-ups, passive external rotation and external rotation. Surgical treatment. Advanced arthritis of the glenohumeral joint can be treated with shoulder replacement surgery. In this procedure, damaged parts of the shoulder are removed and replaced with artificial components called prostheses. Replacement surgery options include hemiarthroplasty.